My name is Jason Schuster. I'm a doctor of physical therapy. I own Intricate Art Spine and Body Solutions. It's a continuing education company teaching other doctors how to do a couple things. Before that, I was a fly fishing guide in between Patagonia, Chile, and southwestern Alaska for a decade. This was just one clip from our peptide class. We're going to have more clips from our different nutrition courses coming out. Keep an eye out for part 2 and for other parts of our other nutrition courses, dry needling courses, and other good educational information. Gastric pentadecapeptide body protective compound 157. That's a pretty good name. It's commonly referred to as BPC-157. That's how I'm going to refer to it, you guys. That's just a long word to say. So BPC-157. So remember, amino acids are the building blocks of peptides, and peptides are the building blocks of proteins. They're all made of the same stuff, and just different amounts of said stuff. The peptides and the proteins are the things that actually do stuff in the body. So BPC-157, it is a synthetic formulation of the natural compound. All drugs, you guys, even if they're so-called natural, it's the natural molecular structure, but they have to be made somewhere. They're derived from people's gut bacteria and stuff like that, and then they're made in a lab. It's the same molecular formula as the one in our body, but it's being made in a lab. So that's just something to keep in mind. BPC-157 is 15 amino acids derived from the stomach's gastric juices. Our microbiome is a super duper important aspect of our health, one of the most important, and it's how functional medicine doctors heal so many people with so-called unhealable conditions, by changing their gut microbiome, looking at what they're deficient in, looking at what they're putting into their body that's not good, eliminating all that, normalizing the gut microbiome, and miraculously people just become healthier. And it makes perfectly good sense, but it's just not the way that mainstream medicine looks at anything, which is why so many people are sick nowadays. And it's also why, you guys, if I ever have to go to the doctor for anything, I absolutely 100% never go to anybody that accepts medical insurance, because that's not good medicine. That's total crap medicine. You'll go in, you'll see the doctor for 2 seconds. They won't care what you say. They won't look into what you say. They won't have the time to think about what you say. So when you go to a functional medicine doctor, typically you pay cash, but they actually understand how the human body works. They use their brain cells to think about stuff, and they treat you as an individual. So if your health is important and you want to get better, going to a typical doctor in mainstream medicine, and unfortunately that's basically any doctor that accepts health insurance, you're not going to be getting good care unless you just get super duper lucky. It's very, very unfortunate, but that's the fact of the matter. And that's why I'm doing these classes, you guys, is because no mainstream medical doctors know anything about this stuff, because it's not taught in medical school. So if you don't take the time to learn stuff after you get out of medical school, which is another reason I like functional medicine doctors, because they're practicing medicine with stuff that was not taught in medical school. So these are people that have taken it upon themselves to continue to learn, and basically everything that they're using in practice. They obviously get the base in medical school, just like doctors of physical therapy do. But the high level stuff that they're doing is all knowledge that's gained after medical school. So BPC-157 has similar effects to human growth hormone, seemingly without any of the negative adverse effects. I like peptides a lot, and I use these peptides because they're the natural building blocks that our body needs to do certain stuff. We're not putting in like the end product. We're putting in the base building blocks and allowing the body to use its own natural mechanisms to do with it what it will. This is not like injecting foreign RNA instructions into your body, which can't do anything but lead to widespread destruction of every single cell in your body. And we're seeing that. These are natural peptides and proteins that human beings have had in their body for hundreds of thousands of years. So it's very, very highly unlikely that you're going to use one of these, especially after it's been tested in animals, that's going to have any significant effect of causing you harm. And it's also a good reason to make sure you know where you're getting these substances, you guys. And we'll talk about that at the end. One of the differences between BPC-157 and growth hormone is that BPC-157 seems to have much longer lasting effects than growth hormone does, without any of the negative lethal things. So very, very high safety profile. The lethal dose, you guys, when they're doing research, is what dose kills 50% of test subjects. So when they're doing this with mice and other animals, about 2 grams per kilogram of body weight is the lethal dose. 1 pound equals 2.2 kilograms. So for a 150-pound person, that's 68 kilograms. So 2 grams, the lethal dose per kilogram of body weight. So that would be for if you weigh 150 pounds, the lethal dose of BPC-157 is 136 grams. 136 grams is the lethal dose for a 150-pound person. The recommended dosing schedule, and again, this is being explored right now, but the recommended dosing schedule for this, you guys, is 2 to 3 times a week on a schedule of like 8 weeks on, 8 weeks off. And the typical dose per time is a subcutaneous injection of 5 milligrams or 0.005 grams. So 5 milligrams is 27,000 times under the lethal dose. So the lethal dose is 27,000 times the typical dose that you take. So it's not like there's any type of close ratio. If you take like twice the typical dose, that you may have a problem. No, you have to take 27,000 times the typical dose, and that would cost you a huge amount of money also. So that really is not an issue with BPC-157 or with any of these other peptides, you guys. And I have all this stuff included in here. Typically it's an injection. One thing to pay attention with BPC-157, and this is the case with some of these other peptides, and I've mentioned it in here. One thing that BPC-157 does, and the way that it works, is it increases something called vascular endothelial growth factor, or VEGF. Some cancer drugs inhibit VEGF. Growth factors, if you have active cancer, theoretically could make said cancer tumor or whatever it is grow more because it's a growth factor. So if you have active cancer, that would be one thing of note to take into consideration, and that would be a time that you would definitely want to get a couple of opinions on would this be something that you wanted to do if you had active cancer or not. But who knows, you guys? These are things that we don't know about this stuff. A lot of these things are shown to have really, really potent anti-cancer effects also. Although it does upregulate VEGF, there's plenty of studies showing that if you take BPC-157 and these other peptides with cancer, again, this is my thought on them, because they're natural peeling peptides, our body can do a lot of different things with said peptides based on how our body methylates or phosphorylates or decarbonates or breaks down the proteins. Our body can add charges onto the proteins in different areas. It can add molecules or remove molecules, and that changes the structure and function of the protein. And these are things that we don't understand how they happen in our cells. Different genes code for different proteins, but they don't code for how the proteins are going to work. That's the thing. There's so many different layers of non-understanding that we don't understand right now, that most people in school, if you just believe that everything what you're taught in school is true, you may come out of school believing that we understand that the DNA basically guarantees how you're going to be, and that is more or less totally wrong. Another study, this guy's great, you guys, Dr. Edwin Lee, he's a medical doctor. I have his website down here, clinicalpeptidesociety.com. That's a great website. He's got a bunch of PowerPoint presentations on there. He's a person that's actively using all these peptides with his patients every day. I've listened to him speak for hours and hours. I've read his research. Again, there's basically no serious adverse effects with any of these peptides, and that is something that cannot be said for any over-the-counter medication. Most over-the-counter medications, and especially most prescriptions, one of the side effects is death, including ibuprofen, which has death listed in the side effects 3 times if you look up the full side effect list. Death is not a side effect of these peptides. So this study, you guys, in this animal study, they could not find a lethal dose to kill 1% of the population. They couldn't find the LD1 dose. They've done lots and lots of studies on animals with this stuff. And this is one of the things that you guys need to keep into consideration. So the pharmaceutical companies, and this is just their pattern of behavior with everything that they do, is if they find something that's very healthy and healing and it's natural, which means they can't patent it, and it's probably safe. What they do is they say that it's super duper dangerous, it doesn't work, and then they put hundreds of millions of dollars looking into how they can change the molecular structure enough so they can get a patent on it and sell it for a ridiculous amount of money like they do with Ozempic, rather than just giving people the natural substance, semaglutide. So they can't patent semaglutide. That's why semaglutide itself is not typically seen on commercials. You can't patent a natural molecule. And what happens when you start changing the molecular structure is it's in a structure for a reason. Once we start screwing with it, that's what gives things a lot of the side effects they have, and it changes the way that they work, and it makes the substance not so recognizable as by the human body because it's been changed. BPC-157 is the natural form. They're not. It's one that they're trying to take off the market right now. So the FDA is actively saying that BPC-157 is dangerous, which is 100% false. That's an active, knowing lie that's limiting very, very healthy, safe medical treatment for the entire population of the United States just because they can't make money off of it. It's absolutely infuriating. It's unacceptable. Unfortunately, that's the way it is. So they did one study with BPC-157 in spinal cord injury rats. They've done it for anti-inflammatory effects, healing of neurons, brain injury, concussive trauma. So BPC-157 seems to be very, very helpful for concussions in cases of encephalopathy. In other studies, BPC-157 was given at 200 micrograms per kilogram 10 minutes after injury. And they followed the injury of after laminectomies, you guys, at 1, 4, 7, 15, 30, 90, 100, and 360 days after injury. So this was a long-term follow-up with an L2, L3 laminectomy in mice, in rats, and 100% of the rats and mice exhibited significant improvements following injury after the BPC-157 application, and it largely counteracted the changes in the microscopic level of the actual neurons themselves. So BPC-157 helps stimulate regrowth of the actual nervous structure, and it helps with angiogenesis, tissue healing, wound healing. It helps with just in general, it helps us heal. So they're showing really, really positive effects with this, with all these peptides, with neurologic conditions, nervous system injuries. It's basically just giving the body the very, very base elements that it needs. This was just one clip from our peptide class. We're going to have more clips from our different nutrition courses coming out. Keep an eye out for part 2 and for other parts of our other nutrition courses, dry needling courses, and other good educational information. Check out our website at intricateartseminars.com, and for big discounts on all of our online and in-person courses, along with a community chat room, weekly Zoom calls, check out our school community, skool.com/CEU, school.com/CEU. Thanks, guys.